NGN NCLEX-RN practice questions with answers. Question 1. A 48-year-old client is in the surgical intensive care unit after having had 3-vessel coronary artery bypass surgery yesterday. She is extubated, awake, alert, and talking. She is receiving digitalis for atrial arrhythmias. This morning serum electrolytes were drawn. Which abnormality would require immediate intervention by the nurse after contacting the physician? Here are the options. Option A. Serum osmolality is elevated, indicating hema concentration. The nurse should increase Roman 4 fluid rate. Option B. Serum sodium is low. The nurse should change Roman 4 fluids to normal saline. Option C. Blood urea nitrogen is subnormal. The nurse should increase the protein in the client's diet as soon as possible. Option D. Serum potassium is low. The nurse should administer KCl as ordered. The correct answer is option D. Serum potassium is low. The nurse should administer KCl as ordered. An elevated serum osmolality poses no immediate danger and is not corrected rapidly. B. A low serum sodium alone does not warrant changing Roman 4 fluids to normal saline. Other assessment parameters, such as hydration status, must be considered. C. A low serum blood urea nitrogen is not necessarily indicative of protein deprivation. It may also be the result of overhydration. D. A low serum potassium potentiates the effects of digitalis, predisposing the client to dangerous arrhythmias. It must be corrected immediately. Question 2. A male client received a heart-lung transplant 1 month ago at a local transplant center. While visiting the nursing center to have his blood pressure taken, he complains of recent weakness and fatigue. He also tells the nurse that he is considering stopping his cyclosporine because it is expensive and is causing his face to become round. He fears he will catch viruses and be more susceptible to infections. The nurse responds to this last statement by explaining that cyclosporine, here are the options. Option A is given to prevent rejection and makes him less susceptible to infection than other oral corticosteroids. Option B is available at discount pharmacies for a reduced price. Option C is usually not necessary after the first year following transplantation. Option D may initially cause weakness, dizziness, and fatigue, but these side effects will gradually resolve themselves. The correct answer is option A. Is given to prevent rejection and makes him less susceptible to infection than other oral corticosteroids. A cyclosporine is the immunosuppressive drug of choice. It provides immunosuppression, but does not lower the white blood cell count. Therefore, the client is less susceptible to infection. B. Cyclosporine is available at discount pharmacies. The cost may be absorbed by health insurance or Medicare if the client is eligible. However, this statement does not address the entire problem verbalized by the client. C. Immunosuppressive agents will be taken for the client's entire life because rejection can occur at any time. D. These side effects do not necessarily resolve in time. However, the client may adapt. Question 3. A 23-year-old college student seeks medical attention at the college infirmary for complaints of severe fatigue. Her skin is pale, and she reports exertional dyspnea. She is admitted to the hospital with possible aplastic anemia. Laboratory values reflect anemia, and the client is prepared for a bone marrow biopsy. She refuses to sign the biopsy consent and states, "Can't you just get the doctor to give me a transfusion and let me go? This weekend begins spring break, and I have plans to go to Florida." At this time, the nurse's greatest concern is that, here are the options. Option A The client may contract an infection as a result of being exposed to large crowds at spring break. Option B. The client does not grasp the full impact of her illness. Option C. The client may require transfusion before leaving for spring break. Option D. The causative agent be identified and treatment begun. The correct answer is option B. The client does not grasp the full impact of her illness. The client could contract an infection, but at this point it is not the most pertinent issue. B. The client's statement indicates that she does not grasp the full impact of her illness. Further client education must be given, along with allowing her to express her feelings regarding her illness. C. The client may require a transfusion, but this is a temporary measure because the causative agent has not been identified. Her feelings regarding her illness must be addressed in order for care to continue. D. A bone marrow is done first to make a definitive diagnosis. Then treatment may begin. Question 4. A 68-year-old man was recently diagnosed with end-stage renal disease. He has not yet begun dialysis, but is experiencing severe anemia with associated symptoms of dyspnea on exertion and chest pain. Which statement best describes the management of anemia and renal failure? Here are the options. Option A. Hematocrit levels usually remain slightly below normal in clients with renal failure. Option B. Transfusion is often begun as early as possible to prevent complications of anemia such as dyspnea and angina. Option C. Anemia in renal failure is frequently caused by low serum iron and ferritin and corrected by oral iron and ferritin replacement therapy. Option D. The renal secretion of erythropoiesis is decreased. The bone marrow requires erythropoietin to mature red blood cells. The correct answer is option D. The renal secretion of erythropoiesis is decreased. The bone marrow requires erythropoietin to mature red blood cells. Clients in renal failure typically have very low hematocrits, often in the range of 1.6 and 22%. B. Transfusion is avoided unless the client exhibits acute symptoms such as dyspnea, chest pain, tachycardia, and extreme fatigue. When a client is given a transfusion, the bone marrow adjusts by producing less red blood cells. C. Anemia in renal failure is caused primarily by decreased erythropoietin. Low serum iron and ferritin may aggravate the anemia and require treatment. D. Decreased secretion of erythropoietin by the kidney is the primary cause of anemia. The bone marrow requires this hormone to mature red blood cells. Treatment is with replacement therapy. Question 5. A female client has married recently. A month ago she visited her physician with complaints of burning on urination. She was given a prescription for trimethoprim sulfamethoxazolbactrim diazepid for 10 days. She was admitted through the emergency room on Saturday evening complaining of flank pain. Her temperature was 104 F. A preliminary urinalysis revealed 31 bacteria along with red and white blood cells in the urine. A preliminary diagnosis of pyelonephritis was made. During a nursing admission assessment, which statement by the client demonstrates a possible cause for pyelonephritis? Here are the options. Option A. I have not been drinking 6 to 8 glasses of water each day as the nurse had instructed. Option B. I'm afraid I may have something wrong with my bladder because I have been getting bladder infections frequently since I've been married. Option C. I took the Bactrim for 6 or 7 days. The burning stopped, so I saved the rest of the medication for the next time. Option D. I recently had the flu, which could be settling in my kidneys now. The correct answer is option C. I took the Bactrim for 6 or 7 days. The burning stopped, so I saved the rest of the medication for the next time. Although it is important that the client drink adequate fluids while treating a bladder infection with trimethoprimsulfamethoxazole, the failure to do so will not cause pyelonephritis. A stricture or abnormality may cause the progression of bladder infection to urinary tract infection, but this is rare. There is no indication in this situation that this has occurred. See, the most common cause of pyelonephritis is improper treatment of bladder infections. The client typically feels better after several days, discontinues the medication, and saves the remainder for the next occurrence of a bladder infection. For this reason, it is imperative to provide client education related to completion of the prescribed medication. D. There is no evidence that infection in another body system could cause pyelonephritis. Question 6. A male client was diagnosed 6 months ago with amyotrophic lateral sclerosis (ALS). The progression of the disease has been aggressive. He is unable to maintain his personal hygiene without assistance. Ambulation is most difficult, requiring him to use a wheelchair and rely on assistance for mobility. He recently has become severely dysphasic. Nursing interventions for dysphagia would be aimed toward prevention of. Here are the options. Option A. Loss of ability to speak and communicate effectively. Option B. Aspiration and weight loss. Option C. Secondary infection resulting from poor oral hygiene. Option D. Drooling. The correct answer is option B. Aspiration and weight loss. A loss of ability to speak is not dysphagia. Although the client may have difficulty communicating, alternative measures can be developed to enhance communication. This goal, while important, is of a lesser priority. B. Dysphagia is difficulty swallowing, which could result in aspiration of food and inability to eat, causing weight loss. C. A secondary infection could result from poor oral hygiene, which could enhance the client's inability to eat, but this goal is of a lesser priority. D. Drooling normally occurs in clients with amyotrophic lateral sclerosis and may require suctioning. Drooling, while aggravating for the client, does not pose an immediate danger. Question 7. A 70-year-old female client is admitted to the medical intensive care unit with a diagnosis of cerebrovascular accident (CVA). She is semi-comatose, responding to pain and change in position. She is unable to speak or cough. In planning her nursing care for the first 24 hours following a CVA, which nursing diagnosis should receive the highest priority? Here are the options. Option A. Ineffective airway clearance related to immobility, ineffective cough, and decreased level of consciousness. Option B. Altered cerebral tissue perfusion related to pathophysiological changes that decrease blood flow. Option C. Potential for injury related to impaired mobility and seizures. Option D. Impaired verbal communication related to aphasia. The correct answer is option A. Ineffective airway clearance related to immobility, ineffective cough, and decreased level of consciousness. An effective airway is necessary to prevent hypoxia and subsequent cardiac arrest. B. Cerebral tissue perfusion is necessary to preserve remaining cerebral tissue, but this goal is secondary to maintenance of an effective airway. C. While prevention of injury is important, it is secondary to maintaining an effective airway and cerebral tissue perfusion. D. Impaired verbal communication is not life-threatening in the acute phase of recovery. It is the lowest priority of the nursing diagnoses listed. Question 8. A 32-year-old female client is being treated for Guillain-Barré syndrome. She complains of gradually increasing muscle weakness over the past several days. She has noticed an increased difficulty in ambulating and fell yesterday. When conducting a nursing assessment, which finding would indicate a need for immediate further evaluation? Here are the options. Option A. Complaints of a headache. Option B. Loss of superficial and deep tendon reflexes. Option C. Complaints of shortness of breath. Option D. Facial paralysis. The correct answer is option C. Complaints of shortness of breath. Headaches are not associated with Guillain-Barré syndrome. B. Loss of superficial and deep tendon reflexes is expected with this diagnosis. C. Complaints of shortness of breath must be further evaluated. 40% of all clients have some detectable respiratory weakness and should be prepared for possible tracheostomy. Pneumonia is also a common complication of this syndrome. D. Facial paralysis is expected and is not considered abnormal. Question 9. A 9-year-old male client arrived via ambulance to the emergency room following a motorcycle accident. He is comatose. His face has evidence of dried blood. On assessment, the nurse notes an obvious injury to his left eye. The preferred positioning for a client with an obvious eye injury is, here are the options. Option A. Reclining to control bleeding. Option B. Any position in which the client is comfortable. Option C. Side lying, either left or right. Option D. Sitting with head support. The correct answer is option D. Sitting with head support. A reclining position can cause a penetrating object to advance further into the eye. B. Prevention of further injury is the priority, not comfort. C. A side-lying position may increase intraocular and intracranial pressure if an accompanying head injury is suspected. D. A sitting position with the head supported will prevent further injury while allowing injury care to take place. Question 10. A female client has been hospitalized for several months following major abdominal surgery for a ruptured colon. A colostomy was created, and the large abdominal wound was left open and allowed to heal through granulation. She is receiving gentamicin rumen 4 for treatment of wound infection. Knowing this drug is ototoxic, the nurse would implement which of the following measures? Here are the options. Option A. Instruct the client to report any signs of tinnitus, dizziness, or difficulty hearing. Option B. Advise the client to discontinue the drug at the first sign of dizziness. Option C. Order audiometric testing in order to determine if hearing loss is caused by an ototoxic drug or other cause. Option D. Instruct the client in Valsalva's maneuver to equalize middle ear pressure and to prevent hearing loss. The correct answer is option A. Instruct the client to report any signs of tinnitus, dizziness, or difficulty hearing. The first nursing measure is to instruct the client in which drug side effects to report. B. Discontinuing the drug is not an independent nursing intervention and may compromise client care. C. Audiometric testing will detect hearing loss, but it does not indicate a potential cause. D. Equalizing middle ear pressure will not prevent hearing loss. Question 11. A male client has experienced low back pain for several years. He is the primary support of his wife and 6 children. Although he would qualify for disability, he plans to continue his employment as long as possible. His back pain has increased recently, and he is unable to control it with non-steroidal anti-inflammatory agents. He refuses surgery and cannot take narcotics and remain alert enough to concentrate at work. His physician has suggested application of a transcutaneous electrical nerve stimulation TENS unit. Which of the following is an appropriate rationale for using a TENS unit for relief of pain? Here are the options. Option A. TENS units have an ultrasonic effect that relaxes muscles, decreases joint stiffness, and increases range of motion. Option B. TENS units produce endogenous opioids that affect the central nervous system with analgesic potency comparable to morphine. Option C. TENS units work on the gate control theory of pain. Biostimulation therapy of large fibers block painful stimuli. Option D. TENS units prevent muscle spasms, decrease the potential for further injury, and minimize pressure on joints. The correct answer is option C. TENS units work on the gate control theory of pain. Biostimulation therapy of large fibers block painful stimuli. TENS units do not have this effect, but whirlpool therapy does. TENS units do not produce endogenous opioids, only the body can do that. TENS units do work based on the gate control theory of pain control. TENS units do not have this effect, but possibly changing the client's position would. Question 12. A male client had a right below-the-knee amputation 4 days ago. His incision is healing well. He has gotten out of bed several times and sat at the side of the bed. Each time, after returning to bed, he has experienced pain as if it were located in his right foot. Which nursing measure indicates the nurse has a thorough understanding of phantom pain and its management? Here are the options. Option A. Phantom pain is entirely in the client's mind. The client should be instructed that the pain is psychological and should not be treated. Option B. The basis for phantom pain may occur because the nerves still carry pain sensation to the brain even though the limb has been amputated. The pain is real, intense, and should be treated. Option C. The cause of phantom pain is unknown. The nurse should provide the client with support, promote sleep, and handle the injured limb smoothly and gently. Option D. Phantom pain is caused by trauma, spasms, and edema at the incisional site. It will decrease when postoperative edema decreases. It should be treated with non-narcotic medication whenever possible. The correct answer is option B. The basis for phantom pain may occur because the nerves still carry pain sensation to the brain even though the limb has been amputated. The pain is real, intense, and should be treated. This statement is entirely false. Phantom pain may be caused by nerves continuing to carry sensation to the brain even though the limb is removed. It is real, intense, and should be treated as ordinary pain would. Although the cause of phantom pain is still unknown, these measures may promote the relief of any type of pain, not just phantom pain. Phantom pain is not caused by trauma, spasms, and edema and will not be relieved by decreasing edema. Question 13. A 28-year-old woman was admitted to the hospital for a thyroidectomy. Postoperatively, she is taken to the post-anesthesia care unit for several hours. In preparing for the client's return to her room, which nursing measure best demonstrates the nurse's thorough understanding of possible post-thyroidectomy complications? Here are the options. Option A. Dressings are placed at the bedside for dressing changes, which are to be done every 2 hours to best detect postoperative bleeding. Option B. Narcotics are readily available and administered when the client returns to her room to prevent excruciating pain. Option C. A tracheostomy set, O2, and suction are available at the bedside. Option D. The nurse should instruct the client as soon as possible on alternative means of communication. The correct answer is option C. A tracheostomy set, O2, and suction are available at the bedside. Dressing changes are done as necessary for bleeding. However, frequently, post-thyroidectomy bleeding may not be visible on the dressing, but blood may drain down the back of the neck by gravity. B. Narcotics are administered for acute pain as necessary. They are not necessarily given on return of the client to her room. C. The most serious post-thyroidectomy complication is ineffective airway and breathing pattern related to tracheal compression and edema. A tracheostomy set, O2, and suction should be available at bedside for at least the first 24 hours postoperatively. D. Impaired verbal communication may occur due to laryngeal edema or nerve damage, but most commonly it occurs due to endotracheal intubation. The client is usually able to communicate but is hoarse. Question 14. A male client is diagnosed with hypoparathyroidism. He has been on dialysis for several years. He is experiencing symptoms such as numbness of the lips, muscle weakness, carpal spasms, and wheezing. Given the client's symptoms, nursing assessment would focus on. Here are the options. Option A. Detection of tetany. Option B. Detection of hypocalcemia to prevent seizures. Option C. Evidence of depression. Option D. Detection of premature cataract formation. The correct answer is option A. Detection of tetany. Assessment should focus on detection of tetany, which is the most common symptom of hypoparathyroidism. Left undetected and untreated, tetany resulting from hypocalcemia can progress to seizures. B. Hypocalcemia is difficult to detect on nursing assessment alone. Abdominal cramping may be an indication of hypocalcemia, but laboratory data are required to confirm diagnosis. C. Depression can be a symptom of hypoparathyroidism, but it is not definitive. D. Premature cataract formation can occur, but it also is not specific to parathyroidism and poses no immediate danger to the client. Topic 5. Question set E. Question 15. A male client has been an insulin-dependent diabetic for approximately 30 years. He frequently indulges in high-sugar foods and forgets to take his insulin. He has not experienced acute diabetic emergencies over the years but is now beginning to demonstrate symptoms of diabetic peripheral neuropathy. This distresses him because dancing is one of his favorite pastimes. He decides to question his wife's home health nurse about diabetic peripheral neuropathy. The nurse points out his non-compliance to his diabetic diet and insulin regimen. The client answers the nurse, "It has been my experience that the diabetic diet is very difficult to follow. As far as the insulin, isn't a fellow allowed to forget now and then?" The client's actions and response best demonstrate. Here are the options. Option A. Depression. Option B. Anger. Option C. Denial. Option D. Bargaining. The correct answer is option C. Denial. A depression may be an underlying feature, but it is not evident from limited data presented here. B. Anger is not exhibited in his response. C. Denial is evident in the client's actions. Through the years, he has had a casual approach to his illness. He only becomes concerned when bodily changes affect his present lifestyle, when in fact he should have been concerned all along. His verbal response also reflects denial. D. There is no evidence of bargaining in the client's actions or verbal response. Question 16. A female client was recently diagnosed with gastric cancer. She entered the hospital and had a total gastrectomy with esophagogynostomy. Her postoperative recovery was uneventful. On conducting discharge teaching, the nurse discusses changes in bodily function and lifestyle changes with the client. In order to prevent pernicious anemia, The nurse stresses that the client must. Here are the options. Option A. Receive monthly blood transfusions. Option B. Increase the amount of iron in her diet. Option C. Eat small quantities several times daily until she is able to tolerate food in moderate portions. Option D. Understand the need for vitamin B12 replacement therapy. The correct answer is option D. Understand the need for vitamin B12 replacement therapy. A monthly blood transfusions are not indicated post-gastrectomy. B. Increasing iron in the client's diet may cause irritation and will not alleviate pernicious anemia. C. It may be necessary that the client eat small meals several times per day, but this measure has no relevance to prevention of pernicious anemia. D. Pernicious anemia is caused by lack of vitamin B12, and replacement therapy will be necessary because the client's stomach has been removed. Question 17. A female client was employed as a client care technician in a hemodialysis unit. She recently began to experience extreme fatigue, being able to sleep for 1,620 hours at a time. She also noted that her urine was tea-colored, which she rationalized was a result of the vitamin she began taking to alleviate fatigue. She was diagnosed with hepatitis B. After a brief hospital stay, she is discharged to her parents' home. Her mother asks the nurse if any precautions are necessary to prevent transmission to the client's family. The nurse explains necessary precautions, which include, here are the options. Option A. Isolation of the client from the remainder of the family. Option B. Separate bathroom facilities if possible. If not, then cleansing daily of the facilities with a chloride solution. Option C. No necessary precautions because she is beyond the contagious phase. Option D. Laundering clothes separately in cold water with a chloride solution. The correct answer is option B. Separate bathroom facilities if possible. If not, then cleansing daily of the facilities with a chloride solution. Isolation is not necessary, even in the acute phase. B. Separate bathroom facilities are recommended. If unavailable, daily cleansing with the chloride solution is recommended. C. Precautions continue to be necessary while the client is in the active phase of hepatitis. D. Clothes are to be laundered separately in hot water with the chloride solution. Question 18. A male client is admitted to the medical surgical unit from the emergency room with a diagnosis of acute pancreatitis. The nurse performs the admission nursing assessment. He is NPO with Roman IV fluids infusing at 100 ml/hour. He is experiencing excruciating abdominal pain. Based on an analysis of these data, which nursing diagnosis would receive the highest priority? Here are the options. Option A. Pain related to stimulation of nerve endings associated with obstruction of the pancreatic tract. Option B. Fluid volume deficit related to vomiting and nasogastric tube drainage. Option C. Knowledge deficit related to treatment regimen. Option D. Altered nutrition, less than body requirements, related to inadequate intake associated with current anorexia, nausea, vomiting, and digestive enzyme loss. The correct answer is option A. Pain related to stimulation of nerve endings associated with obstruction of the pancreatic tract. A relief of pain is the primary goal of nursing intervention because this client is experiencing acute pain. B. Fluid volume deficit is being treated with Roman IV fluid replacement. C. Knowledge deficit will not be addressed at this time because a client in acute pain is not ready to learn. D. Alteration in nutrition is the third priority after relief of pain and fluid volume deficit. Question 19. A male client has burns over 90% of his body after an automobile accident resulting in a fire. He was trapped inside the auto and pulled out by a bystander. After several months in the hospital and over 20 surgeries, discharge planning has begun. Throughout his hospitalization, the nursing staff has been aware of psychological changes the client faces after burns over a large portion of his body resulting in disfigurement. The nursing staff can best foster the client's self-esteem by. Here are the options. Option A. Adhering to a strict schedule of diet, exercise, and wound care. Option B. Allowing him to go to physical therapy for whirlpool treatment when other clients were not in physical therapy. Option C. Following a standardized plan of care for burn clients formulated by a world-renowned burn center. Option D. Allowing him to plan, assist in, and perform his own care whenever possible. The correct answer is option D. Allowing him to plan, assist in, and perform his own care whenever possible. A regimented schedule, allowing no flexibility, will not foster the client's self-esteem. B. Isolating the client may only enhance his feelings of social isolation due to his disfigurement. C. Standardized care plans must be personalized and adapted to each client's situation. D. Allowing the client control over his care will foster his self-esteem and prepare him for life outside of the hospital. Question 20. A 20-year-old client presents to the obstetrics gynecology clinic for the first time. She tells the nurse that she is pregnant and wants to start prenatal care. After collecting some initial assessment data, the nurse measures her fundal height to be at the level of the umbilicus. The nurse estimates the fetal gestational age to be approximately, here are the options. Option A, 10 weeks. Option B, 16 weeks. Option C, 20 weeks. Option D, 30 weeks. The correct answer is option C, 20 weeks. At 10 weeks, the fundus is located slightly above the symphysis pubis. B. At 16 weeks, the fundus is halfway between the symphysis pubis and the umbilicus. C. At 20 weeks, the fundus is located approximately at the umbilicus. D. At 30 weeks, the fundal height is about 30 cm or 10 cm above the umbilicus. Question 21. A female client presents to the obstetric gynecology clinic for a pregnancy test, the result which turns out to be positive. Her last menstrual period began December 10, 1993. Using Negel's rule, the nurse estimates her date of delivery to be. Here are the options. Option A, September 17, 1994. Option B, September 10, 1994. Option C, September 3, 1994. Option D, August 17, 1994. The correct answer is option A, September 17, 1994. According to Negel's rule, the estimated date of delivery is calculated by adding 7 days to the date of the first day of the normal menstrual period. December 10 plus 7 days equals December 17, and then by counting back 3 months, December 17-3 mo equals September 17. B, C, D. These answers are incorrect. Question 22. A female client comes for her second prenatal visit. The nurse midwife tells her, "Your blood tests reveal that you do not show immunity to the German measles." Which notation will the nurse include in her plan of care for the client? We'll need here are the options. Option A, RH immune globulin at the next visit. Option B, RH immune globulin within 3 days of delivery. Option C, rubella vaccine at the next visit. Option D, Rubella vaccine after delivery on the day of discharge. The correct answer is option D. Rubella vaccine after delivery on the day of discharge. A Rh immune globulin is given to Rh-negative mothers to prevent the maternal Rh immune response. B. Rh immune globulin is given to Rh-negative mothers to prevent the maternal Rh immune response. C. The rubella vaccine is not given during pregnancy because of its teratogenicity. D. Non-immune mothers are vaccinated early in the postpartum period to prevent future infection with the rubella virus. Question 23. A female client at 37 weeks gestation has just undergone a non-stress test. The results were 2 fetal movements with a corresponding increase in fetal heart rate FHR of 15 BPM lasting 15 seconds within a 20-minute period. Her results would be classified as, here are the options. Option A, reactive, needs follow-up contraction stress test. Option B, reactive, no contraction stress test required. Option C, non-reactive, needs follow-up contraction stress test. Option D, non-reactive, no contraction stress test required. The correct answer is option B, reactive, no contraction stress test required. A contraction stress test is unnecessary following a reactive normal non-stress test. B. The results are considered reactive, indicating that the fetus is not showing distress. Therefore, a contraction stress test, which is a more in-depth test for fetal distress, is unnecessary. C. A non-reactive test would show fewer than 2 fetal movements or a failure of the FHR to increase at least 15 BPM with the movements in a 20-minute period. D. A contraction stress test should follow a non-reactive non-stress test to validate fetal distress. Question 24. A female client at 36 weeks gestation has been treated successfully for premature labor for 4 weeks. She has begun having uterine contractions today and has been admitted to the labor and delivery suite. Her amniocentesis results reveal a lecithin/sphingomyelin L/S ratio of 2 and positive phosphatidylglycerol PD. These lab values indicate, here are the options. Option A, placental maturity. Option B, suspected chronic asphyxia. Option C, cord compression. Option D, fetal lung maturity. The correct answer is option D, fetal lung maturity. A placental maturity is assessed by a biophysical profile. BL/S ratio and presence of phosphatidylglycerol are not used to determine fetal asphyxia. A biophysical profile score of 6 may indicate this condition. C. Cord compression is not reflected by the L/S ratio or presence of phosphatidylglycerol. Variable decelerations observed through electronic fetal monitoring could reflect umbilical cord compression. D. An L/S ratio 2 and the presence of phosphatidylglycerol in amniotic fluid indicate fetal lung maturity. Question 25. A prima gravida with a blood type A negative is at 28 weeks gestation. Today her physician has ordered a RhoDAM injection. Which statement by the client demonstrates that more teaching is needed related to this therapy? Here are the options. Option A, I'm getting this shot so that my baby won't develop antibodies against my blood, right? Option B, I understand that if my baby is Rh positive, I'll be getting another one of these injections. Option C, this shot should help to protect me in future pregnancies if this baby is Rh positive, like my husband. Option D, this shot will prevent me from becoming sensitized to Rh positive blood. The correct answer is option A. I'm getting this shot so that my baby won't develop antibodies against my blood, right? A ROGM is given to Rh-negative mothers to prevent the maternal Rh immune response to fetal Rh-positive antigens. B. If the infant is Rh-positive, the mother will receive another dose post-delivery to prevent maternal sensitization. C. Prevention of maternal sensitization will protect future pregnancies because the mother's blood will be free of antibodies against her fetus. D. ROGM prevents maternal sensitization to Rh-positive blood. Question 26. At her monthly prenatal visit, a client reports experiencing heartburn. Which nursing measure should be included in her plan of care to help alleviate it? Here are the options. Option A. Restrict fluid intake. Option B. Use Alka-Seltzer as necessary. Option C. Eat small, frequent bland meals. Option D. Lie down after eating. The correct answer is option C. Eat small, frequent bland meals. At least 8 glasses of fluid per day are encouraged to help dilute stomach contents, thereby decreasing irritation. B. Alka-Seltzer contains aspirin, which is irritating to gastric mucosa and therefore should be avoided. C. Small, frequent bland meals help to decrease gastric pressure and to prevent reflux. D. Lying down after meals may cause gastric reflux and prevents optimal gastric emptying. Question 27. A client is dilated 8 cm and entering the transition phase of labor. Common behaviors of the laboring woman during transition are, here are the options. Option A. Frustration, vague in communication. Option B. Seriousness, some difficulty following directions. Option C. Calmness, follows directions easily. Option D. Excitement, openness to instructions. The correct answer is option A. Frustration, vague in communication. During the transition phase, the mother may become frustrated and unclear in her communication owing to severe pain and fear of loss of control. B. These behaviors are common in the active phase of labor. C. These behavioral clues are seen in the latent phase of labor. D. These characteristics are observed in the latent phase of labor. Question 28. The FHR pattern in a laboring client begins to show early decelerations. The nurse would best respond by, here are the options. Option A. Notifying the physician. Option B. Changing the client to the left lateral position. Option C. Continuing to monitor the FHR closely. Option D. Administering O2 at AL/min via face mask. The correct answer is option C. Continuing to monitor the FHR closely. Early decelerations are reassuring and do not warrant notification of the physician. B. Because early decelerations is a reassuring pattern, it would not be necessary to change the client's position. C. Early decelerations warrant the continuation of close FHR monitoring to distinguish them from more ominous signs. DO2 is not warranted in this situation, but it is warranted in situations involving variable and/or late decelerations. Question 29. A female client is admitted to the emergency department complaining of severe right-sided abdominal pain and vaginal spotting. She states that her last menstrual period was about 2 months ago. A positive pregnancy test result and ultrasonography confirm an ectopic pregnancy. The nurse could best explain to the client that her condition is caused by. Here are the options. Option A. Abnormal development of the embryo. Option B. A distended or ruptured fallopian tube. Option C. A congenital abnormality of the tube. Option D. A malfunctioning of the placenta. The correct answer is option B. A distended or ruptured fallopian tube. The embryo itself may develop normally in the first several weeks of an ectopic pregnancy. An ectopic pregnancy in the fallopian tube causes severe pain owing to the size of the growing embryo within the narrow lumen of the tube, causing distension and finally rupture within the first 12 weeks of pregnancy. The fallopian tube may either be normal or contain adhesions caused by a history of pelvic inflammatory disease or tubal surgeries, neither of which are congenital causes. An ectopic pregnancy does not involve a dysfunctional placenta, but the implantation of the blastocyst outside the uterus. Question 30. A female client at 10 weeks gestation complains to her physician of slight vaginal bleeding and mild cramps. On examination, her physician determines that her cervix is closed. The client is exhibiting signs of. Here are the options. Option A. An inevitable abortion. Option B. A threatened abortion. Option C. An incomplete abortion. Option D. A missed abortion. The correct answer is option B. A threatened abortion. An inevitable abortion includes the signs of cervical dilation and effacement as well as pain and bleeding. A threatened abortion is a condition in which intrauterine bleeding occurs early in pregnancy. The cervix remains undilated, and the uterine contents are not necessarily expelled. An incomplete abortion occurs when some portions of the products of conception are expelled from the uterus. A missed abortion occurs when the embryo dies in utero and is retained in the uterus. Question 31. A female client at 36 weeks gestation is experiencing preterm labor. Her physician has prescribed 2 doses of betamethasone 12 mg IMQ 24H. The nurse explains that she is receiving this drug to. Here are the options. Option A. Treat fetal respiratory distress syndrome. Option B. Prevent uterine infection. Option C. Promote fetal lung maturation. Option D. Increase uteroplacental circulation. The correct answer is option C. Promote fetal lung maturation. A respiratory distress syndrome occurs in the newborn, not the fetus. It may be treated postnatally with surfactant therapy. Betamethasone is a corticosteroid, not an anti-infective drug. Therefore, its use would not prevent uterine infection. Betamethasone binds with glucocorticoid receptors in alveolar cells to increase production of surfactant, thus increasing lung maturity in the preterm fetus. Betamethasone does not affect uteroplacental circulatory exchange. Question 32. A female client at 30 weeks gestation is brought into the emergency department after falling down a flight of stairs. On examination, the physician notes a rigid, board-like abdomen, FHR in the 160s, and stable vital signs. Considering possible abdominal trauma, which obstetric emergency must be anticipated? Here are the options. Option A. Abruptio placentae. Option B. Ectopic pregnancy. Option C. Massive uterine rupture. Option D. Placenta previa. The correct answer is option A. Abruptio placentae. Abruptio placentae, the complete or partial separation of the placenta from the uterine wall, can be caused by external trauma. When hemorrhage is concealed, one sign is a rapid increase in uterine size with rigidity. Ectopic pregnancy occurs when the embryo implants itself outside the uterine cavity. Massive uterine rupture occurs during labor when the uterine contents are extruded through the uterine wall. It is usually due to weakness from a pre-existing uterine scar and trauma from instruments or an obstetrical intervention. Deplacenta previa is the condition in which the placenta is implanted in the lower uterine segment and either completely or partially covers the cervical OS. Question 33. A 4 days postpartum client who is gravida 3, para 3, isomined by the home health nurse during her first postpartum home visit. The nurse notes that she has a pink vaginal discharge with a serous-inguineous consistency. The nurse would most accurately chart the client's lochia as, here are the options. Option A, rubra. Option B, rosa. Option C, serosa. Option D, alba. The correct answer is option C, serosa. A lochia rubra is bloody with clots and occurs 13 days postpartum. B. There is no such term as lochia rosa. C. Lochia serosa is a pink-brown discharge with a serous-inguineous consistency that occurs 49 days postpartum. D. Lochia alba is yellow to white in color and occurs approximately 10 days postpartum. Question 34. A primipara is assessed on arrival to the postpartum unit. The nurse finds her uterus to be boggy. The nurse's first action should be to. Here are the options. Option A, call the physician. Option B, assess her vital signs. Option C, give the prescribed oxytocic drug. Option D, massage her fundus. The correct answer is option D, massage her fundus. The nurse should first implement independent and dependent measures to achieve uterine tone before calling the physician. B. Assessment of vital signs will not help to restore uterine atony, which is the priority need. C. Giving a prescribed oxytocic drug would be necessary if the uterus did not maintain tone with massage. D. Fundal massage generally restores uterine tone within a few moments and should be attempted first. Question 35. A female client plans to bottle feed her newborn. Her physician has ordered bromocriptine parlitol to suppress lactation. Which of the following instructions about bromocriptine should be given by the nurse? Here are the options. Option A. Bromocriptine stimulates the production of prolactin. Option B. Hypertension is a primary side effect. Option C. Bromocriptine is generally taken for 5 days. Option D. Her blood pressure must be stable before starting bromocriptine. The correct answer is option D. Her blood pressure must be stable before starting bromocriptine. A bromocriptine inhibits the secretion of prolactin. B. Hypotension is a side effect of this drug. Hypertension is not. C. Bromocriptine is generally taken for 14 days. D. The administration of bromocriptine is delayed at least 4 hours postpartum and given only when the client's blood pressure is stable, because it can cause hypotension and syncope. Question 36. The postpartum nurse should include which of the following instructions to breastfeeding mothers? Here are the options. Option A. Limit feeding times for several days to avoid nipple soreness. Option B. Wash the nipples with soap and water before and after each feeding. Option C. Daily caloric intake should be increased by 500 cal. Option D. Breast milk is totally digestible by the baby because it contains lactose. The correct answer is option C. Daily caloric intake should be increased by 500 cal. Limiting initial feeding times will only delay nipple soreness as well as the establishment of the letdown reflex, thus encouraging engorgement from clogged ducts and ductules. B. Soap should be avoided because it may be excessively drying, predisposing nipples to cracking. C. For optimal milk production, an additional 500 kcal over maintenance levels are needed daily. D. Lipase, not lactose, emulsifies the fat in breast milk, making it almost totally digestible by infants. Question 37. At 12 hours post-vaginal delivery, a female client is without complications. Which of the following assessment findings would warrant further nursing interventions? Here are the options. Option A. Apical pulse of 52 bpm. Option B. Uterine fundus palpable left of midline. Option C. No bowel movement since delivery. Option D. Oral temperature of 100.4 F. The correct answer is option B. Uterine fundus palpable left of midline. A bradycardia of 5070 bpm may be considered normal postpartally because the heart compensates for the decreased resistance in the pelvis. B. The uterus is displaced from the midline by a full bladder. This condition could lead to a boggy uterus and increased risk of postpartal hemorrhage. Therefore, the bladder should be kept empty. C. Re-establishment of normal bowel function is delayed into the first postpartum week. D. A postpartum woman's oral temperature may go as high as 100.4 F within 24 hours of delivery, resulting from muscular exertion, dehydration, and hormonal changes. Question 38. The nurse observes a client crying quietly. She has just experienced a spontaneous abortion at 9 weeks gestation. An appropriate response by the nurse would be, here are the options. Option A. It must be God's will and probably is for the best. Option B. This must be a difficult time for you. Would you like to talk about it? Option C. I'm sure your other children will be a comfort for you. Option D. Don't worry, you're still young. If I were you, I'd just try again. The correct answer is option B. This must be a difficult time for you. Would you like to talk about it? This response is non-therapeutic because it belittles the client's response and gives a meaningless rationalization. B. This response acknowledges the client's feelings and demonstrates the therapeutic offering of self by the nurse. C. This response is non-therapeutic because it does not focus on the client's feelings and offers false reassurance. D. This response is non-therapeutic because it belittles the client's feelings and offers her advice. Question 39. A 48-hour-old male infant is ordered to have phototherapy. When his mother questions the nurse about its purpose, the nurse explains that phototherapy. Here are the options. Option A. Prevents the development of ophthalmia neonatorum. Option B. Assists the baby's clotting mechanism. Option C. Breaks down bilirubin in the skin into substances that can be excreted in stool or urine. Option D. Increases levels of unconjugated bilirubin, thereby preventing kernicterus brain damage. The correct answer is option C. Breaks down bilirubin in the skin into substances that can be excreted in stool or urine. The installation of erythromycin ophthalmic preparation, not phototherapy, prevents ophthalmia neonatorum. B. The administration of vitamin K aquamephytin assists the infant's clotting mechanism. C. Excessive bilirubin accumulates when the infant's liver cannot handle the increased load caused by the breakdown of red blood cells postnatally. This excessive bilirubin seeps out of the blood and into the tissues, staining them yellow. Phototherapy accelerates the removal of bilirubin from the skin by breaking it down into substances that can be excreted in stool or urine. D. Phototherapy decreases levels of unconjugated bilirubin, thereby preventing kernicterus. Question 40. After instructing a female client on circumcision care, The nursery nurse asks her to restate some of the key points covered. Which statement shows that the client will properly care for her son's circumcision? Here are the options. Option A. I'll make sure I soak the gauze with warm water first, before I take it off each time. Option B. I'll make sure that I report any drainage around where they operated. Option C. I'll apply alcohol to the area daily to clean it and prevent any infection. Option D. I'll keep a close watch on it for a day or two. The correct answer is option A. I'll make sure I soak the gauze with warm water first, before I take it off each time. Before petrolatum gauze is removed, it should be soaked with warm water to prevent trauma to adherent tissues. B. A yellow exudate often forms normally over the surgical site. Only if it becomes foul-smelling and purulent would it need to be reported. C. Alcohol should never be used on the site. This would be extremely painful to the infant. D. Special care and observance should continue until the site is completely covered with clean, pink granulation tissue, which could take 710 days. Question 41. A male infant is to be discharged home this morning. Which instruction related to his cord care should be included in his mother's discharge teaching plan? Here are the options. Option A. Keep the umbilical area moist with Vaseline until the stump falls off. Option B. Keep the umbilical area covered at all times with the diaper. Option C. Clean the umbilical cord with alcohol at each diaper change. Option D. Clean the umbilical cord daily with soap and water during the bath. The correct answer is option C. Clean the umbilical cord with alcohol at each diaper change. The umbilical area should be kept dry for healing to occur. Moisture is conducive to bacterial growth and therefore could lead to infection at the site. B. The diaper should be folded below the cord to allow the cord stump to be exposed to the air for healing. C. The umbilical cord should be swabbed with alcohol at each diaper change to remove urine and stool and to facilitate the desiccation process through drying. D. Soap and water should not be used to clean the umbilical area because the area could retain moisture, thus making it susceptible to bacterial growth and infection. Question 42. Which behavior by a female client feeding her newborn demonstrates that she needs more teaching related to safety and infant feeding? Here are the options. Option A. She uses the bulb syringe to help clear her baby's nose when milk is regurgitated. Option B. She places her infant on her right side after feeding her. Option C. She props the bottle in the crib to feed her baby, which allows her to write birth announcements and feed her baby at the same time. Option D. She burps her baby by placing her in a sitting position, supporting her head and neck and gently massaging her back. The correct answer is option C. She props the bottle in the crib to feed her baby, which allows her to write birth announcements and feed her baby at the same time. This practice is the proper use of the bulb syringe to clear the infant's airway in case of regurgitation. B. Placing the infant on either side or on the stomach prevents aspiration of regurgitated milk. C. Bottle propping is an unsafe practice because it increases the likelihood of aspiration. D. This practice is one correct way of burping an infant. Question 43. Newborns are routinely screened for phenylketonuria. The nursery nurse ensures that this screening test is performed. Here are the options. Option A. Immediately after birth, because the most accurate result is obtained at this time. Option B. After 23 days of milk ingestion. Option C. At 23 days of age regardless of amount of milk feedings. Option D. At 1 month, because the biochemical buildup of phenylalanine takes 1 month to detect. The correct answer is option B. After 23 days of milk ingestion. The infant has not ingested any protein immediately after birth, which is necessary to detect excessive serum phenylalanine. B. It is important that the infant take in 23 full days of milk or formula feedings to preclude a false negative reading. C. At 23 days of age, inadequate milk could have been ingested owing to a delay in the initial feeding. D. The biochemical buildup of serum phenylalanine is detectable after 23 days of milk or formula ingestion. Question 44. A 3-year-old child has had symptoms of influenza including fever, productive cough, nausea, vomiting, and sore throat for the past several days. In caring for a young child with symptoms of influenza, the mother must be cautioned about. Here are the options. Option A. Giving aspirin and bismuth subsalicylate Pepto-Bismol to treat the symptoms. Option B. Giving clear liquids too soon. Option C. Allowing the child to come in contact with other children for 3 days. Option D. The possibility of pneumonia as a complication. The correct answer is option A. Giving aspirin and bismuth subsalicylate Pepto-Bismol to treat the symptoms. Aspirin should never be given to children with influenza because of the possibility of causing Ray's syndrome. Pepto-Bismol is also classified as a salicylate and should be avoided. B. Depending on the severity of symptoms, the child may be receiving Roman 4 therapy or clear liquids. C. The disease has a 13-day incubation period and affected children are most infectious 24 hours before and after the onset of symptoms. D. Although viral pneumonia can be a complication of influenza, this would not be an initial priority. Question 45. A 10-year-old boy has been diagnosed with Legg-Calvé-Perles disease. Which of the client's responses would indicate compliance during initial therapy? Here are the options. Option A. Drinking large amounts of milk. Option B. Not bearing weight on affected extremity. Option C. Walking short distances 3 times/day. Option D. Putting self on weight reduction diet. The correct answer is option B. Not bearing weight on affected extremity. This condition causes aseptic necrosis of the head of the femur in the acetabulum. Drinking large quantities of milk at this time cannot hasten recovery. B. The aim of treatment is to keep the head of the femur in the acetabulum. Non-weight bearing is essential. Activity causes microfractures of the epiphysis. C. In addition to non-weight bearing, clients are often placed on bed rest, which helps to reduce inflammation. Later, active motion is encouraged. D. Weight is not generally an issue with this disease. Slipped femoral capital epiphysis, which is most frequently observed in obese pubescent children, usually requires a weight reduction diet. Question 46. A 7-year-old girl has been diagnosed with juvenile arthritis and has been placed on daily aspirin. Which statement made by the parent indicates a need for further teaching? Here are the options. Option A. My daughter takes her aspirin with her meals. Option B. Her gums have been bleeding frequently. Maybe she is brushing too hard. Option C. I give her aspirin on a regular schedule every day. Option D. One sign of aspirin toxicity can be ringing in the ears. The correct answer is option B. Her gums have been bleeding frequently. Maybe she is brushing too hard. Aspirin should not be given on an empty stomach because it is irritating to the mucosa. B. Bleeding from decreased clotting capacity may be caused by aspirin toxicity. C. A regular schedule of aspirin administration is important to maintain a satisfactory drug level in the body. D. Aspirin toxicity may affect cranial nerve Roman 8, leading to tinnitus ringing in the ears. Question 47. A young child has been placed in a SPICA cast. The chief concern of the nurse during the first few hours is, here are the options. Option A. Prevention of neurovascular complications. Option B. Prevention of loss of muscle tone. Option C. Immobilization of the affected limb. Option D. Using heated fans to dry the cast. The correct answer is option A. Prevention of neurovascular complications. Because the extremity may continue to swell and the cast could constrict circulation, the nurse should elevate the limb and observe for capillary refill, warmth, mobility of toes and circulation. B. Although muscle tone may diminish over time in the affected limb, this is not the immediate concern. C. The limb has been immobilized already by the cast, and therefore immobilization is not a concern. D. Heated fans and dryers are discouraged because the outside cast will dry quickly, yet the area beneath the cast remains wet and could cause burns. Question 48. The pediatrician has diagnosed tinea capitis in an 8-year-old girl and has placed her on oral glycofulvin. The nurse should emphasize which of these instructions to the mother and/or child. Here are the options. Option A. Administer oral glycofulvin on an empty stomach for best results. Option B. Discontinue drug therapy if food tastes funny. Option C. May discontinue medication when the child experiences symptomatic relief. Option D. Observe for headaches, dizziness, and anorexia. The correct answer is option D. Observe for headaches, dizziness, and anorexia. Giving the drug with or after meals may allay gastrointestinal discomfort. Giving the drug with a fatty meal, ice cream, or milk increases absorption rate. B. Glycofulvin may alter taste sensations and thereby decrease the appetite. Monitoring of food intake is important, and inadequate nutrient intake should be reported to the physician. C. The child may experience symptomatic relief after 4 to 96 hours of therapy. It is important to stress continuing the drug therapy to prevent relapse, usually about 6 weeks. D. The incidence of side effects is low. However, headaches are common. Nausea, vomiting, diarrhea, and anorexia may occur. Dizziness, although uncommon, should be reported to the physician. Question 49. A 12-year-old girl has been diagnosed with insulin-dependent diabetes mellitus. Which of these principles would best guide her nutritional management? Here are the options. Option A. Concentrated sweets are taken during increased activity. Option B. Food restriction is imposed to reduce weight. Option C. Caloric distribution should be calculated to fit activity patterns. Option D. Fat requirements are increased owing to the possibility of ketoacidosis. The correct answer is option C. Caloric distribution should be calculated to fit activity patterns. Concentrated sweets are eliminated from diet planning. Complex carbohydrates may be taken at the time of increased activity. B. Food restriction is not used for diabetic control of growing children. Caloric restriction may be imposed for weight control if necessary. C. Total caloric intake and proportions of basic nutrients should be consistent from day to day. Distribution of these calories should fit the activity pattern. Extra food is needed for increased activity. A balance of food, exercise, and insulin should be maintained. D. Because of the increased risk of atherosclerosis, The fat percentage of the total caloric intake is reduced. Question 50. A 5-year-old has just had a tonsillectomy and adenoidectomy. Which of these nursing measures should be included in the postoperative care? Here are the options. Option A. Encourage the child to cough up blood if present. Option B. Give warm, clear liquids when fully alert. Option C. Have child gargle and do toothbrushing to remove old blood. Option D. Observe for evidence of bleeding. The correct answer is option D. Observe for evidence of bleeding. The nurse should discourage the child from coughing, clearing the throat, or putting objects in his mouth. These may induce bleeding. Be cool, clear liquids may be given when child is fully alert. Warm liquids may dislodge a blood clot. The nurse should avoid red or brown-colored liquids to distinguish fresh or old blood from ingested liquid should the child vomit. C. Gargles and vigorous toothbrushing could initiate bleeding. D. Postoperative hemorrhage, though unusual, may occur. The nurse should observe for bleeding by looking directly into the throat and for vomiting of bright red blood, continuous swallowing, and changes in vital signs. Question 51. A 4-week-old infant is admitted to the emergency room in respiratory distress. Which of the following statements indicates the nurse's knowledge of the anatomy of the respiratory system in pediatric clients? Here are the options. Option A. The diameter of the trachea is much smaller in children than in adults. Option B. The tongue is proportionally smaller in children than in adults. Option C. The pediatric airway is more rigid than that of the adults. Option D. The length of the pediatric airway is longer in children than in adults. The correct answer is option A. The diameter of the trachea is much smaller in children than in adults. The airway in children is much smaller than it is in adults. The diameter of the trachea in the newborn is 4 mm, and that of the adult is 20 mm. A small change in the diameter of the airway can make a major difference in the pediatric client. B. The tongue is proportionally larger in children and fills most of the oral cavity, thereby decreasing airspace. C. The entire pediatric airway is elastic. Elasticity diminishes with age, however. D. The distances between respiratory structures are shorter than that of adults, and therefore organisms are able to move more rapidly down the throat, leading to more extensive respiratory involvement. Question 52. A 10-year-old has been diagnosed with acute post-streptococcal glomerulonephritis. The clinical findings were proteinuria, moderately elevated blood pressure, and periorbital edema. Which dietary plan is most appropriate for this client? Here are the options. Option A. Low-protein diet. Option B. Low-sodium diet. Option C. Increased fluid intake. Option D. High cholesterol diet. The correct answer is option B. Low-sodium diet. A high-protein diet is usually indicated because protein is excreted in urine. Protein restriction is usually prescribed with severe azotemia. B. The kidneys usually enlarge in these children, and sodium and water are retained. C. Fluid restriction may be ordered to help reduce edema. However, monitoring for dehydration is indicated. D. A high cholesterol diet would not be indicated for any child, especially one with elevated blood pressure. Question 53. A 6-year-old girl has been diagnosed with a urinary tract infection secondary to vesicoarterial reflux. Which statement by her mother indicates a need for further teaching? Here are the options. Option A. I have taught her to wipe from front to back after urinating. Option B. I make sure she drinks plenty of fluids every day. Option C. She enjoys wearing nylon panties, but I make her change them every day. Option D. She tries to empty her bladder completely after she urinates, like I told her. The correct answer is option C. She enjoys wearing nylon panties, but I make her change them every day. A wiping from front to back is wiping from an area of lesser contamination urethra to an area of greater contamination rectum. B. Generous fluid intake reduces the concentration of urine. C. Cotton is a natural, absorbent fabric. Nylon often predisposes the client to urinary tract infections. Dark, warm, moist areas are excellent media for bacterial growth. D. With vesicoureteral reflux, urine refluxes into the ureter S during voiding and then returns to the bladder residual, which becomes a source for future infection. Question 54. A 1-year-old child is to receive an IM injection ordered by his pediatrician. He has fallen asleep in his mother's arms when the nurse approaches. Which approach is most appropriate at this time? Here are the options. Option A. Give the injection in the vastus lateralis site before the child awakens. Option B. Awaken the child first and give the injection in the ventrogluteal site. Option C. Awaken the child first and give the injection in the dorsogluteal site. Option D. Ask the mother to place the child on the examination table and leave the room, and then give the injection in an appropriate site. The correct answer is option B. Awaken the child first and give the injection in the ventrogluteal site. If awakened first, the child will know that nothing painful will be done without the child being alerted. B. The ventrogluteal site is a safe site for children because it is a large muscle free of major nerves and blood vessels. C. The dorsogluteal site is not recommended in children who have not been walking for at least 1 year because the muscle is not fully developed. D. The parent will be able to offer support and comfort during and after the injection. Question 55. The physician has ordered that ampicillin 250 mg Roman 4 be given over 30 minutes. The medication is diluted as recommended in 10 ml in the volume control chamber of a set that has a tubing of 12 ml. Which nursing measure is most accurate considering these facts? Here are the options. Option A. Infuse volume at 44 ml/HR. Option B. Infuse volume at 22 ml/HR. Option C. Infuse volume at 10 ml/HR. Option D. Infuse volume at 30 ml/HR. The correct answer is option A. Infuse volume at 44 ml/HR. The volume to be infused should be diluted medication volume added to the volume control chamber 10 ml plus the tubing volume 12 ml. The general formula for calculating Roman 4 medications for children is rate equals volume to be infused x administration set drop factor microdrop 60 GTTS/min desired time to infuse in minutes rate equals 10 plus 1222 x 6030 equals 44 ml/HR. B, C, D. These values are incorrect. Question 56. An infant weighing 15 lb has just been treated for severe diarrhea in the hospital. Discharge instructions by the nurse will include maintenance fluid requirements for the pediatric client. Which of the following values best indicates the nurse's understanding of normal fluid requirements for this infant? Here are the options. Option A. 240 ml/day. Option B. 680 ml/day. Option C. 330 ml/day. Option D. 960 ml/day. The correct answer is option B, 680 ml/day. A, C, D. These answers are incorrect. B. Normal fluid requirement for this pediatric client is based on the fact that 0-10 kg of weight equals 100 ml/kg per day. This infant weighs 15 pounds 6.8 kg. Thus, 100 ml x 6.8 equals 680 ml/day. Question 57. A normal 3-year-old child is suspected of having meningitis. The doctor has ordered a lumbar puncture. In light of this procedure and developmental characteristics of this age group, which nursing measure is most appropriate? Here are the options. Option A. Emphasize those aspects of the procedure that require cooperation. Option B. Tell the child not to cry or yell. Option C. Tell the child that he will get a stick in his back. Option D. Use medical terminology when explaining the procedure to the client. The correct answer is option A. Emphasize those aspects of the procedure that require cooperation. The nurse should emphasize what is required to elicit cooperation and help to develop a sense of autonomy. B. The child may express discomfort verbally and should be encouraged to express his feelings. C. Selecting non-threatening words to explain a procedure will prevent misinterpretation. D. When explaining the procedure to the parent with the child present, the nurse should use words that the child can understand to avoid misunderstanding. Question 58. A mother brings a 6-month-old infant and a 4-year-old child to the nursing clinic for routine examination and screening. Which of these plans by the nurse would be most successful? Here are the options. Option A. Examine the 4-year-old first. Option B. Provide time for play and becoming acquainted. Option C. Have the mother leave the room with one child and examine the other child privately. Option D. Examine painful areas first to get them over with. The correct answer is option B. Provide time for play and becoming acquainted. The 6-month-old should be examined first. If several children will be examined, begin with the most cooperative and less anxious child to provide modeling. B. Providing time for play and getting acquainted minimizes stress and anxiety associated with assessment of body parts. C. Children generally cooperate best when their mother remains with them. D. Painful areas are best examined last and will permit maximum accuracy of assessment. Question 59. An 11-month-old infant is admitted with a possible diagnosis of pyloric stenosis. Which of the following best describes the characteristic clinical manifestations of pyloric stenosis? Here are the options. Option A. Pain, especially when eating. Option B. Poor appetite and sucking reflex. Option C. Increased frequency and quantity of stools. Option D. Palpable olive-shaped mass in the epigastrium just right of the umbilical cord. The correct answer is option D. Palpable olive-shaped mass in the epigastrium just right of the umbilical cord. There is no evidence of pain in infants with pyloric stenosis whether eating or not. B. There are both good appetite and feeding habits in these children. C. Because of regurgitation, there is usually decreased frequency and quantity of stools and also signs of dehydration and weight loss. D. Along with upper abdominal distension, there is a characteristic palpable olive-shaped mass located to the right of the umbilicus. Question 60. As soon as a child has been diagnosed as hearing impaired, special education should begin. Which of the following special education tasks is the most difficult for a severely hearing impaired child? Here are the options. Option A. Auditory training. Option B. Speech. Option C. Lip reading. Option D. Signing. The correct answer is option B. Speech. With a slight and mild hard of hearing, auditory training is beneficial. B. Speech is the most difficult task because it is learned by visual and auditory stimulation, imitation, and reinforcement. C. D. Lip reading and signing are aimed at establishing communicative skills, but they are learned more easily by visual stimulation. Question 61. A 15-year-old child is admitted to the pediatric unit with a diagnosis of thalassemia. Which of the following would be included in educating the mother and child as part of discharge planning? Here are the options. Option A. Give oral iron medication every day. Option B. Have the child's blood pressure monitored every week. Option C. Know the signs and symptoms of iron overload. Option D. Keep exercise at a minimum to reduce stress. The correct answer is option C. Know the signs and symptoms of iron overload. Oral iron supplements are contraindicated in thalassemia. B. Although heart failure may be an end result of this disease, this action is unnecessary. C. Iron overload is a potential complication of frequent blood transfusions of children with thalassemia. D. Children should be encouraged to pursue activities related to their exercise tolerance. Question 62. An 8-year-old boy has been diagnosed with hemophilia. Which of the following diagnostic blood studies is characteristically abnormal in this disorder? Here are the options. Option A. Partial thromboplastin time. Option B. Platelet count. Option C. Complete blood count. Option D. Bleeding time. The correct answer is option A. Partial thromboplastin time. A partial thromboplastic time measures activity of thromboplastin, which depends on the intrinsic clotting factors deficient in children who are hemophiliacs. B. Platelet counts are normal in hemophilia. C. Hemophilia does not affect the complete blood count. D. Bleeding times are normal in hemophiliacs. They measure the time interval for the bleeding from small superficial wounds to cease. Question 63. A murmur has been discovered during the routine physical examination of a 1-year-old child. The parent is extremely concerned about this diagnosis. Which of the following explanations by the nurse indicates understanding of this dysfunction? Here are the options. Option A. The blood shifts from the right to the left atrium. Option B. Surgical closure by suture or patches recommended before school age. Option C. Most atrial septal defects close spontaneously. Option D. The child can be treated medically with antibiotics to prevent bacterial endocarditis. The correct answer is option D. Surgical closure by suture or patches recommended before school age. Because the left atrial pressure is greater than right atrial pressure, oxygenated blood flows from the left to the right atria. B. Because of the risk of pulmonary obstructive diseases and congestive heart failure later in life, surgery is usually performed between age 4 and 6 years, with essentially no operative mortality or postoperative complications. C. Many ventricular septal defects close spontaneously 2060% as a result of growth and proliferation of the muscular septum or formation of a membrane across the opening. D. This management is usually recommended with children with mild pulmonary stenosis. Question 64. An alcoholic client who is completing the inpatient segment of a substance abuse program was placed on disulfiram anti-abuse drug therapy. What should the nurse include in the discharge instructions? Here are the options. Option A. If disulfiram is taken and alcohol ingested, the client experiences nausea, vomiting, and elevated blood pressure. Option B. Disulfiram is most effective when prescribed as late as possible in a recovery program. Option C. Disulfiram works on the desensitization principle. Option D. The effects of disulfiram can be triggered by alcohol 5 days to 2 weeks after the drug is discontinued. The correct answer is option D. The effects of disulfiram can be triggered by alcohol 5 days to 2 weeks after the drug is discontinued. When alcohol is ingested with disulfiram therapy, the client experiences nausea, vomiting, and a potentially serious drop in blood pressure. B. Disulfiram is most successful when used early in the recovery process while the individual makes major lifestyle changes necessary for long-term recovery. C. Disulfiram works on the classical conditioning principle. D. The effects of disulfiram can be felt when alcohol is ingested 12 weeks after disulfiram is discontinued. Question 65. An 82-year-old former restaurant owner walks to the nursing station and states, "I have to go." The restaurant opens at 11 a.m. Which response by the nurse is the most appropriate? Here are the options. Option A. Go back to your room. You do not own a restaurant. Option B. You are in the hospital now. Calm down. Option C. You once owned a restaurant. Tell me about it. Option D. It is snowing outside. The restaurant is closed. The correct answer is option C. You once owned a restaurant. Tell me about it. This response cuts off communication with the client. It does not address her feelings. B. Reality orientation frequently does not work alone. Feelings must be addressed. Telling a client to calm down is frequently ineffective. C. Reminiscence is used here to reorient and recall past pleasant events. Talking about the restaurant will allay anxiety. D. This response may confirm to the client that she indeed does still own a restaurant, buying into her confusion. Her feelings and anxiety require nursing intervention. Question 66. A 15-year-old female adolescent is frequently breaking the rules of the unit. She has left the unit and was found smoking in the bathroom and spending a large amount of time in the male ward. Which statement by the nurse would best explain to the teenager why she must follow the rules of the unit? Here are the options. Option A. It is not easy, but the rules must be followed so that everyone can get a fair chance. Option B. If you do not follow the rules, you will be transferred to the closed, locked unit. Option C. You are not being fair to the other clients by getting them involved in your deviant behavior. Option D. Break the rules all you want, but don't get caught again. The correct answer is option A. It is not easy, but the rules must be followed so that everyone can get a fair chance. This statement acknowledges that it is difficult but is not threatening or punitive. B. This statement is threatening and describes specific punishment for further deviant behavior. C. This response elicits shame by blaming her for involving others. D. This response gives her permission to break the rules but indicates that getting caught is wrong. Question 67. A 45-year-old male client experiences a sense of depression because he has not yet achieved his life's goals. His career has not been satisfying. He is still looking for the right job. His wife spends too much money, and his children seem to ignore him while being very selfish. He is tired of all of their attitudes and is considering buying a red Corvette convertible. While obtaining these data concerning the client's feelings about his life, the nurse is able to determine he is experiencing what psychological crisis according to Erickson stages. Here are the options. Option A: identity versus role confusion. Option B: integrity versus despair. Option C: intimacy versus isolation. Option D: generativity versus self-absorption. The correct answer is option D: generativity versus self-absorption. Identity versus role confusion is experienced by adolescents making the transition from childhood to adulthood as they attempt to develop a sense of identity. B: integrity versus despair is experienced by the elderly as they reflect on their life in an attempt to find meaning. C: intimacy versus isolation is experienced by young adults as they establish intimate bonds of love and friendship. D: generativity versus self-absorption is experienced by middle-aged adults as they fulfill life goals that involve family, career, and society. The client is experiencing this crisis. Question 68. A female client is anticipating a visit with her parents over the Thanksgiving holidays. She has recently begun experiencing periods of extreme shortness of breath, which her physician has labeled as panic attacks. Which of the following statements by the nurse would enhance therapeutic communication? Here are the options. Option A: why do you feel this way? Option B: tell me about your dislike for your parents. Option C: don't worry, everything will be all right on your visit with your parents. Option D: perhaps you and I can discover what produces your anxiety. The correct answer is option D: perhaps you and I can discover what produces your anxiety. Asking the client to provide an explanation for her feelings is often intimidating. B: this response is probing and may make the client feel used and valued only for the information she can provide. C: this underrates the client's feelings and belittles her concerns. It may cause the client to stop sharing feelings for fear that they will be ridiculed. D: the emphasis is on working with the client. It shows that there is hope for change through collaboration. Question 69. A female client has experienced varying degrees of depression throughout her life. Now that she is postmenopausal, her depression has increased. She is unable to motivate herself to clean her house or even to get out of bed and get dressed in the morning. The client was begun on fluoxetine Prozac therapy. When educating her about fluoxetine, what might the nurse caution her about? Here are the options. Option A: a daily dose of fluoxetine may be taken in the morning or evening. Option B: fluoxetine is not sedating. Therefore, restrictions on driving and other hazardous activities are not necessary. Option C: rashes or pruritus usually occur early in the therapy and are treatable without discontinuing the medication. Option D: it is safe to take over-the-counter or other prescription medications with fluoxetine. The correct answer is option C. Rashes or pruritus usually occur early in the therapy and are treatable without discontinuing the medication. A daily dose of fluoxetine should be taken in the morning. Afternoon doses may cause nervousness and insomnia. B: although fluoxetine is less sedating than other antidepressants, it may still cause dizziness or drowsiness in some clients. The nurse should caution clients to avoid driving or hazardous activities until the central nervous system effects of the drug are demonstrated. C: rashes or pruritus do commonly occur early in therapy and respond to antihistamines or topical corticosteroids. D: advise the client not to take over-the-counter or other prescription drugs without consulting with a physician. Fluoxetine does interact with other common drugs such as monoamine oxidase inhibitors, diazepam, insulin, oral antidiabetic agents, tricyclic antidepressants, and tryptophan. Question 70. A male client seeks counseling after his wife of 19 years threatened to divorce him. For most of their marriage, he has physically and verbally abused her. When asked about his behavior in the process of the nursing assessment, the client states, "I was mean to my wife because she insists on cooking meals and wearing clothes that I do not like." This defense mechanism is an example of, here are the options. Option A, repression. Option B, regression. Option C, reaction formation. Option D, rationalization. The correct answer is option D, rationalization. A repression is blocking a desire from conscious expression. The client is conscious of his desires. B, regression is returning to an earlier form of expression, which is not demonstrated here. C, reaction formation is acting out the opposite of true feelings. The client felt anger concerning his wife's cooking and acted out his feelings. D, rationalization is unconsciously falsifying an experience by giving a rational explanation. The client is attempting to justify his behavior by giving an explanation. Question 71. A male client is admitted to the psychiatric unit after experiencing severe depression. He states that he intends to kill himself, but he asks the nurse not to repeat his intentions to other staff members. Which response demonstrates understanding and appropriate action on the part of the nurse? Here are the options. Option A, I understand you're depressed, but killing yourself is not a reasonable option. Option B, we need to discuss this further, but right now let's complete these forms. Option C, don't do that, you have so much to live for. You have a wonderful wife and children. The client in the next room has no one. Option D, this is very serious. I do not want any harm to come to you. I will have to report this to the rest of the staff. The correct answer is option D. This is very serious. I do not want any harm to come to you. I will have to report this to the rest of the staff. To the client, suicide may be a reasonable action and the only one he can cope with at this time. B, this response indicates to the client that his intention to commit suicide is not important to the nurse at this time. C, the client is so depressed that he is not able to see the positive aspects of his life. At no time should the nurse discuss another client's problems in conversation. D, this statement tells the client that the nurse recognizes his problem is of a serious nature and will take all steps necessary to help him. Question 72. During the admitting mental health assessment, a client demonstrates involuntary muscular activity. He has a marked facial tic around the mouth that is distracting to the nurse during the interview. The nurse recognizes the behavior and documents it as. Here are the options. Option A, dyskinesia. Option B, akathisia. Option C, ekapraxia. Option D, echolalia. The correct answer is option A, dyskinesia. The client is demonstrating dyskinesia, which is involuntary muscular activity such as tic, spasm, or myoclonus. B, akathisia is regular rhythmic movements usually of the lower limbs, such as constant motor restlessness. C, ekapraxia is mimicking the movements of another person. D, echolalia is mimicking the speech of another person. Question 73. A female client is seeking counseling for personal problems. She admits to being very unhappy lately at both home and work. During the nursing assessment, she uses many defense mechanisms. Which statement or action made by the client is an example of adaptive suppression? Here are the options. Option A. I did not get the raise because my boss does not like me. Option B. I felt a lump in my breast 2 weeks ago. I put off getting it checked until after my sister's wedding. Option C. My son died 3 years ago. I still cannot bring myself to clean out his room. Option D. My husband told me this morning that he wants a divorce. I am upset, but I cannot discuss the matter with him until after my company's board meeting today. The correct answer is option D. My husband told me this morning that he wants a divorce. I am upset, but I cannot discuss the matter with him until after my company's board meeting today. This statement is an example of adaptive rationalization. She is coping with her disappointment by rationalizing. This is adaptive because no harm is done to self or others. It is used to protect her ego. This is an example of maladaptive suppression. She is suppressing the seriousness of the lump. It is maladaptive because delaying treatment will cause harm to her. See, the client's actions are an example of maladaptive denial. She is denying her son's death by not facing his possessions. Until she faces his death, she cannot face reality. This is an example of adaptive suppression. She realizes the impact of her husband's statement, but delays discussion until she can devote her full attention to the matter. Question 74. When interviewing parents who are suspected of child abuse, the nurse would use which of the following interview techniques? Here are the options. Option A. Be direct, honest, and attentive. Option B. Approach them in the emergency room as soon as you suspect abuse to clear the air right away. Option C. Ask the parents what they could have done differently to prevent this from happening to the child. Option D. After the interview, call Child Protective Services. The correct answer is option A. Be direct, honest, and attentive. The nurse must be honest, direct, professional, and attentive in her interview to gain the parents' trust. B. The nurse should approach the parents in private, away from the child. C. Asking them to relive and evaluate the situation may be looked at as placing blame on the parents for the child's accident. At this point, the parents may get defensive and stop communicating. D. Although you may call Child Protective Services, the nurse should inform the parents of their responsibility to do this and explain the process to them. Question 75. In an interview for suspected child abuse, the child's mother openly discusses her feelings. She feels her husband is too aggressive in disciplining their child. The child's father states, being a school custodian, I see kids every day that are bad because they did not get enough discipline at home. That will not happen to our child. Based on this remark, the nurse would make the following nursing diagnosis. Here are the options. Option A. Fear related to retaliation by the father. Option B. Actual injury related to poor impulse control by the father. Option C. Ineffective coping. Option D. Altered family process related to physical abuse. The correct answer is option D. Altered family process related to physical abuse. There is no evidence of fear as the child is unable to communicate. B. There is actual injury, but the parents have not yet admitted causing the child's injuries. C. This diagnosis is incomplete. There is no specific ineffective coping behavior identified in this nursing diagnosis. The altered family process best describes the family dynamics in this situation. The parents have admitted severe disciplinary action. Question 76. A 40-year-old client has lived for 8 years with an abusive spouse. She married her husband in her senior year of high school after becoming pregnant. Shortly after the baby was born, he began to physically abuse her. She has attempted to leave him several times, but she has always returned. She is unable to support herself financially, and her husband threatens to kill her if she leaves him. This time, her husband has beaten her so badly she cannot stop the bleeding from the gash above her eye. She admits her husband caused her injury. In assessing a person after experiencing spousal abuse, which need has the highest priority? Here are the options. Option A. Assess the level of anxiety, coping responses, and support systems. Option B. Assess the history of physical abuse. Option C. Assess suicide potential. Option D. Assess drug and alcohol use. The correct answer is option C. Assess suicide potential. Assessing the level of anxiety, coping responses, and support systems is very important, but not of highest priority at this time. A history of physical abuse is an important part of assessment. The nurses must also always ask if there is abuse of the children. C. Although all of these answers are very important in assessment, the highest priority is assessment of suicide potential, because this could cause the greatest harm to the client. Feeling there is no other way out, abused spouses may consider suicide. D. The spouse may be self-medicating herself with alcohol or drugs to escape an awful situation. The abuser may also be abusing drugs or alcohol. If this is so, the nurse should encourage the spouse to seek counseling and not to return to the home. Question 77. As a nurse in the emergency room, you receive an outside call from an elderly woman who states she has just been raped. She states, "I know I must come to the hospital, but what do I do next?" You advise her to call the police, then come to the hospital emergency room. What action by the nurse would indicate an understanding of the examination process once the victim enters the emergency room? Here are the options. Option A. Inform the victim not to wash, change clothes, douche, brush teeth, or eat or drink anything. Option B. Inform the victim to bring insurance information with her to the hospital so she can be properly cared for. Option C. Phone a rape counselor to begin working with the victim as soon as she enters the hospital. Option D. Do not leave the victim alone to collect her thoughts. The correct answer is option A. Inform the victim not to wash, change clothes, douche, brush teeth, or eat or drink anything. Providing the victim with these instructions will aid in the determination of physical evidence of rape. Victims frequently feel dirty after rape, and their first instinct is to take care of personal hygiene before facing anyone. B. This action is of lesser importance at this time. C. Although this is a nursing measure appropriate in this situation, contacting a counselor can be done once the victim enters the hospital. Frequently victims call but do not follow up with the visit. D. Once the victim enters the emergency room, it is important not to leave her alone. Question 78. A 14-year-old teenager is demonstrating behavior indicative of an obsessive-compulsive disorder. She is obsessed with her appearance. She will not leave her room until her hair, clothes, and makeup are perfect. She always dresses immaculately. Recently, she expressed disgust over her appearance after she gained 5 lb. After observing a marked weight loss over a 2-week period, her mother suspects that she is experiencing bulimia. She eats everything on her plate, then runs to the bathroom. In interviewing the teenager, she discusses in great detail all of the events leading to her bulimia, but not her feelings. What defense mechanism is she using? Here are the options. Option A. Dissociation. Option B. Intellectualization. Option C. Rationalization. Option D. Displacement. The correct answer is option B. Intellectualization. A dissociation is separating a group of mental processes from consciousness or identity, such as multiple personalities. That is not evident in this situation. B. Intellectualization is excessive use of reasoning, logic, or words usually without experiencing associated feelings. This is the defense mechanism that this client is using. C. Rationalization is giving a socially acceptable reason for behavior rather than the actual reason. She is discussing events, not reasons. D. Displacement is a shift of emotion associated with an anxiety-producing person, object, or situation to a less threatening object. Question 79. A male client is experiencing extreme distress. He begins to pace up and down the corridor. What nursing intervention is appropriate when communicating with the pacing client? Here are the options. Option A. Ask him to sit down. Speak slowly and use short, simple sentences. Option B. Help him to recognize his anxiety. Option C. Walk with him as he paces. Option D. Increase the level of his supervision. The correct answer is option C. Walk with him as he paces. The nurse should not ask him to sit down. Pacing is the activity he has chosen to deal with his anxiety. The nurse dealing with this client should speak slowly and with short, simple sentences. B. The client may already recognize the anxiety and is attempting to deal with it. C. Walk with the client as he paces. This gives support while he uses anxiety-generated energy. D. Increasing the level of supervision may be appropriate after he stops pacing. It would minimize self-injury and or loss of control. Question 80. A 24-year-old graduate student recognizes that he has a phobia. He suffers severe anxiety when he is in darkness. It has altered his lifestyle because he is unable to go to a movie theater, concert, and other events that may require absence of light. The client is seeking assistance because he is no longer able to socialize with friends due to his phobia. The psychologist working with him is using desensitization. He has asked the nursing staff to assist the client in muscle relaxation techniques. What result would indicate client education has been successful? Here are the options. Option A. He enters a movie theater, sits in his chair, and replaces anxiety with relaxation as the theater darkens. Option B. He enters a concert, but as the lights dim, he does not experience anxiety. Option C. He states that he no longer fears dark places. Option D. He takes a part-time job as a photographic assistant. His job necessitates his working in a dark room. The correct answer is option A. He enters a movie theater, sits in his chair, and replaces anxiety with relaxation as the theater darkens. This situation provides specific evidence that the client is able to integrate muscle relaxation technique into his lifestyle to alleviate anxiety. B. The client may not experience anxiety at the concert, but there is no evidence regarding the technique that he used to alleviate anxiety. C. The client may state he no longer experiences anxiety, but there is no evidence demonstrating this. He may be denying anxiety to discontinue therapy prematurely. D. Does he experience anxiety in the darkroom? He may have taken this job to force himself to deal with the phobia directly. Question 81. A female client has just died. Her family is requesting that all nursing staff leave the room. The family's religious leader has arrived and is ready to conduct a ceremony for the deceased in the room, requesting that only family members be present. The nurse assigned to the client should perform the appropriate nursing action, which might include Here are the options. Option A. Inform the family that it is the hospital's policy not to conduct religious ceremonies in client rooms. Option B. Refuse to leave the room because the client's body is entrusted in the nurse's care until it can be brought to the morgue. Option C. Tell the family that they may conduct their ceremony in the client's room. However, the nurse must attend. Option D. Respect the client's family's wishes. The correct answer is option D. Respect the client's family's wishes. It is rare that a hospital has a specific policy addressing this particular issue. If the statement is true, the nurse should show evidence of the policy to the family and suggest alternatives, such as the hospital chapel. B. Refusal to leave the room demonstrates a lack of understanding related to the family's need to grieve in their own manner. C. The nurse should leave the room and allow the family privacy in their grief. D. The family's wish to conduct a religious ceremony in the client's room is part of the grief process. The request is based on specific cultural and religious differences dictating social customs. Question 82. A female client has been recently diagnosed as bipolar. She has taken lithium for the past several weeks to control mania. What must be included in client education regarding lithium toxicity? Here are the options. Option A. Maintain a normal diet, however, limit salt intake to no more than 3 g/day. Option B. Take lithium between meals to increase absorption. Option C. Withhold lithium if experiencing diarrhea, vomiting, or diaphoresis. Option D. For pain or fever, avoid aspirin or acetaminophen Tylenol. Non-steroidal anti-inflammatory drugs are preferred. The correct answer is option C. Withhold lithium if experiencing diarrhea, vomiting, or diaphoresis. The client should maintain a normal diet including normal salt intake. A low-sodium diet can cause lithium retention, leading to toxicity. B. Lithium must be taken with meals because it is irritating to the gastric mucosa. C. Diarrhea, vomiting, or diaphoresis can cause dehydration, which will increase lithium blood levels. If these symptoms occur, the nurse should instruct the client to withhold lithium. D. Lithium is not to be taken with over-the-counter drugs without specific instruction. Some drugs raise lithium levels, whereas others lower lithium levels. Question 83. For the past several months, an elderly female client with Alzheimer's disease has experienced paranoia, hallucinations, and aggressive, disruptive behavior. The family is utilizing haloperidol as needed to control her behavior. On nursing assessment, you note that the client demonstrates involuntary movements of the tongue and fingers. This may most likely indicate, here are the options. Option A. Tardive dyskinesia, which may be a side effect of antipsychotic medication. Option B. Early symptoms of Parkinson's disease. Option C. A more advanced stage of Alzheimer's disease than previously experienced by the client. Option D. The need to change her medication from haloperidol to another antipsychotic drug to lessen symptoms. The correct answer is option A. Tardive dyskinesia, which may be a side effect of antipsychotic medication. A tardive dyskinesia is a common side effect of antipsychotic medications such as haloperidol. Discontinuing the medication can alleviate symptoms. B. Although mild tremors are an early sign of Parkinson's disease, haloperidol must be discontinued first and the client further evaluated. C. These symptoms do not necessarily indicate a more advanced stage of Alzheimer's disease. D. Most antipsychotic drugs are chemically similar and will produce the same side effects. Question 84. A 32-year-old male client is a marketing representative. His job requires him to have a tremendous amount of energy during the day. He frequently uses cocaine to sustain his energy level. Lately, he has increased his use of cocaine and even experimented with crack cocaine. Realizing he can no longer continue this destructive behavior, he is seeking treatment for cocaine addiction. In planning nursing care for the client's inpatient stay, which expected outcome is most appropriate? Here are the options. Option A. He will attend 4 consecutive group educational sessions on substance abuse. Option B. He will name activities that he would most likely be involved in post-treatment. Option C. He will meet with his family in counseling sessions and discuss his feelings. Option D. He will be able to deal with his feelings through participation in group therapy sessions. The correct answer is option D. He will be able to deal with his feelings through participation in group therapy sessions. This expected outcome is specific as related to attendance, but not specific as related to outcome criteria. B. Stating activities does not guarantee involvement. C. This goal may help the recovery process, but post-counseling behavior is not addressed. D. This statement best describes the expected outcome. The client will be attending group therapy sessions, and through them he will deal with his feelings. Question 85. A client has been instructed in how to take her nitroglycerin tablets. The nurse giving her instructions knows the client understands the information when she tells her. Here are the options. Option A. I should contact my physician if I have headaches after I take this medicine. Option B. I should keep the tablets in the refrigerator. Option C. I should call the doctor if 3 doses of the medicine do not relieve my pain. Option D. I should take these with water, but not with milk. The correct answer is option C. I should call the doctor if 3 doses of the medicine do not relieve my pain. Headaches may occur after taking nitroglycerin because of vasodilation. B. The tablets do not need to be refrigerated. The client should carry them with her. C. The client should contact the physician if repeated doses of nitroglycerin do not relieve the discomfort. D. Nitroglycerin tablets should be dissolved under the tongue, not swallowed. Question 86. A client has renal failure. Today's lab values indicate he has an elevated serum potassium. What additional priority information does the nurse need to obtain? Here are the options. Option A. Evaluation of his level of consciousness. Option B. Evaluation of an electrocardiogram. Option C. Measurement of his urine output for the past 8 hours. Option D. Serum potassium lab values for the last several days. The correct answer is option B. Evaluation of an electrocardiogram. The level of consciousness is not affected by elevated potassium levels. B. An electrocardiogram EKG can tell the nurse whether this client is experiencing any cardiac dysfunction or arrhythmias related to the elevated potassium level. C. Measurement of the urine output is not a priority nursing action at this time. D. The client's serum potassium values for the past several days may provide information about his renal function, but they are not a priority at this time.